5 tips for
sweaty pits.
Whew. We live in a humid place in the summer, and we see a lot of underarm complaints from sweating, right?
Yes, absolutely.
Yeah, so if you're an injector and you inject underarms, I'm gonna give you some 5 tips and maybe a bonus at the end of how to do this and keep your patients happy. So first thing is communicating with the patient. You know, some patients, not all, but some really are pinpoint about where they have it, right in the middle, not out further out, and they can tell you. If they can't, then you have to go with that, but you try to communicate so in case they do have a problem area within their armpit, you've addressed it for them. Next is making a grid. Draw lines across and then the other way, make little boxes, and that's really important because when you're down in the weeds concentrating, you can get lost at where you want to go, so you want to have those markings to guide you. It's really helpful.
So what type of dilution do you use for underarms and hyperhidrosis?
Yeah, dilution that I use is 2-to-1. We put 2 cc's of the preservative saline into the bottle to concentrate our Botox 2-to-1. There are different dilutions for different types of neurotoxins. In this case, I'm talking about Botox. You can translate that to whatever you use if it's something different. But I find that a 1-to-1 dilution is too tight and it doesn't spread enough. And if you go beyond a 2-to-1, effectiveness, it does not seem to be as good. You know, you can't just keep using more of a dilution. So 2-to-1 for me seems to be the sweet spot.
Okay.
Speaking of all that, you don't want to run out of Botox. You don't want to start going and then you get to the last third and you don't have any more Botox left.
Right.
So whatever dosage I'm using is not all in one syringe. Maybe I could plan it out better in my head, but I like visual cues. So I've got, usually my syringes are in 5 or 10 units. And so I'll know, okay, in the first third, I've got two syringes or whatever it is. Just you want to make sure you don't neglect the last part and just not do it. That's not a good look.
So I've seen your technique adjusted a little bit when you're treating this area. Tell me a little bit about that.
When it comes to the injection itself, I will make more points and do smaller amounts, but the technique of the needle is very, very superficial. So I'll bring that bevel in almost parallel and just get it under the skin. And if I don't see a little bleb raised, I'm probably not superficial enough. So I can't emphasize enough to go very superficial with these. There's no muscle belly you're getting. You're affecting the nerves that go to the hair follicles. So very, very superficial injections for sure, underarm.
Is that it?
Wait, there's more. Here's a little bonus. You want to concentrate the bulk, the majority of your units towards the center, but the key is so you can put more in the center and a little bit less laterally, but don't miss going lateral enough. In other words, if it seems to be right where the hair-bearing area is, do 1 or 2 little injections just to the outside edge of that. Otherwise, you might have a thing where they say, you know, it worked, but there's like the outer parts are just not as good as the inner. And it's not because they sweat more there, it's just because you haven't quite gone far enough. Go a little further than you think you have to.